Great, thank you very much. So now I want to move on to the topic of effectiveness of these therapies, how effective they are, and the risk of late recurrence and duration of treatment. So to get started, can you tell us how effective endocrine therapy is at preventing a recurrence? And maybe, one of the patients on our platform shared with us that she has been given several different answers to this question and is hoping you can share your experience on what you have seen in your practice. For this patient, just as an example, she has seen answers that range from 1% to 50% reduction in breast cancer recurrence rate, which I have to say, that's pretty wide. So give us your perspective, Dr. Smith.
Endocrine therapy definitely reduces the risk of recurrence and actually improves survival, makes women ultimately less likely to pass away from breast cancer. When we talk about the benefits from endocrine therapy, it can be difficult to measure because we are really talking about risk, and there's two different kinds of risk. There's relative risk and absolute risk. So I would say that in general, taking endocrine therapy almost halves or approximately halves the risk of a cancer from returning. Now, what that turns into in terms of absolute risk reduction depends on what the individual patient's risk was to start with. So for example, if you have a patient who has a very large tumor that has spread to the lymph glands and is quite aggressive and has a high chance of coming back, if you have that, that's a big difference between those two numbers. Let's say it went from 50% down to 25%. You get a 25% absolute benefit. But let's say that you have a patient, on the other hand, that had a very small breast cancer that was node negative and had a starting level risk of 5%, and we have that, her risk goes down to 2.5%, and the difference is only 2.5%. So that's how the numbers, I think, can kind of be a little bit confusing.